Cells and tissues, presented by Allison Paul as a 5-point extra credit for Lab Practical 1. Simple squamous epithelial cells are thin cells in a disc-like shape. They facilitate diffusion. The thinness of the cells ease the exchange of air, in the case of CO2 and oxygen, within the alveoli of the lungs, fluids within the lymph nodes, nutrients in blood vessels, and toxins through the kidneys and urinary tract. They can be found in blood vessels, the heart cavity, lymph nodes, alveoli, and the urinary tract. Columnar epithelial cells facilitate secretion, primarily mucus and acid in the stomach, and absorption of nutrients and water within the small intestine and the large intestine. Many have microvilli to increase surface area for absorption, as seen in the small intestine. They have an oblong shape. They can be found in the stomach, small intestine, and large intestine. Simple cuboidal epithelium have a cube shape. They are secretion cells, primarily found in the pancreas, which secretes insulin, and the salivary glands, which secrete saliva and amylase. Can also be found in the tubules of the kidney and the bronchioles of the lungs. Stratified squamous epithelial cells are flat with many layers. They are keratinized in the case of the skin or non-keratinized in the case of the esophagus and mouth. They function as a protection and to build structure. They're resistant to abrasion and other traumas. Transitional epithelium are layers of cells varying in size and shape. They can exist in a distended or contracted state in response to the volume of urine within the bladder. They are found in the ureters and the bladder. Pseudostratified columnar epithelial cells are a clustered single layer of cells. They look stratified but are not, again, a single layer. They have cilia on their exposed surface, which work together to keep debris and in the lungs and eggs in the reproductive tract moving towards their intended destination. They can be found in the trachea and fallopian tubes. Areolar connective tissue is multiple loose, non-uniform groupings of fibers in a medium viscosity matrix. They contain fibroblasts, which create fibers in the tissue, macrophages, which are immune cells that consume foreign bodies, fat cells, which hold lipids in adipose tissue, plasma cells, which make antibodies during infections, mast cells, which are closely located to capillaries and are critical for inflammation reactions, as well as capillaries, which are the smallest blood vessels. Areolar connective tissue is found in superficial fascia, which is located all over the body, deep to the dermis. Adipose connective tissue is a collection of fat cells structured by collagen and reticular fibers. They are located near capillaries and the lymph systems. Adipose connective tissue is used for fuel storage, maintaining the body temperature, acts as a shock absorber, and holds vitamins A, D, E, and K, which are fat-soluble vitamins. Can be found in breast tissue, around the abdominal cavity, and in the glutes and upper legs. Dense regular connective tissue is a condensed parallel groups of elastic and collagen fibers. It makes up the ligaments and tendons that can withstand stress but allows a limited amount of stretch. They are primarily composed of fibroblasts. Dense irregular connective tissue is made up of irregular condensed and intermingled collagen fibers, along with trace amounts of elastic fibers. These wrap muscle tissue, liver, and the spleen. They are the primary components of the dermis. Dense irregular connective tissue is resistant to trauma, has a low cell count, and low vascularization. Can be found in joint capsules, muscle tissue, the liver, the spleen, and the dermis. Hyaline cartilage is a non-vascular, compoundable, and resistant to pain. It is porous to increase the absorption of oxygen and nutrients. Can be found on the end of bones, the end of your nose, in the construction of the larynx, in the lower respiratory tract, and is in the outline of newly forming bones. Elastic cartilage is hyaline cartilage with additional elastic fibers as well as a small amount of collagen. It can be found in the external ear and construction of the epiglottis. Fibrocartilage is dense fiber tissue interspliced with cartilage and an intercellular matrix. It is strong with an ability to be flexible, resistant to blows and external pullings and tuggings. Can be found in the intervertebral discs. Thank you.